This is a story about the most common medical procedure occurring in hospitals worldwide, namely the insertion of a peripheral cannula. Most people call them drips. It is fair to credit this medical device as being one of the most important innovations in medical science and healthcare. It has helped cure the sick and alleviate suffering, but it is not without consequence. In 2012, a group of vascular access researchers, led by Dr. Evan Alexandro, came up with an idea to survey a few hospitals around the world. Interest in the study intensified, collaboration and research is encouraged, and the net was cast wider. They were overwhelmed with registrants. That few is well over 700 in over 60 different countries, and has evolved into an audacious attempt to survey 1 million global catheters. The study has become affectionately known as the OMG study. In 2014, when Barack Obama attended the G20 Global Summit in Brisbane, another global event was gathering pace. The OMG team, now based at the Avatar Group at Griffith University in Brisbane, were busy communicating with various hospitals around the world, translating their OMG study documents into 14 different languages.
And I am very proud to represent my country.
In the Southern Hemisphere, from Australia to Argentina, and from Canada to China in the Northern Hemisphere, this study has developed unique relationships with clinicians in the first world countries and those in some of the poorest countries. One unique among many is Eli, a healthcare professional working in the Democratic Republic of the Congo. His experience differs so much from those in the Western and First Worlds. While some organizations were challenged by the bureaucratic governance of ethics, Eli's concerns were simpler: paper to print the study documents out on, and pens to write with, and more serious, surviving a nearby civil war. This is the story of an impossible dream, an unfunded research study involving real clinical nurses and doctors with no previous research experience, just a friend on email, Gillian Ray Burrell, behind a huge committed research machine with the Avatar Group, sharing, reaching out across the seas, curious to know how we are doing in our unit, curious to know what others are doing in their practice. It is the story about one of the most important medical innovations in medicine today. It is a story of friendships, of laughter, of collaboration, and relationships with professionals committed to caring for people. This is Cannula, the documentary of the 1 million global catheter study.